Hello, my name is Nurse Pauline RN. Welcome to my channel. The goal of my channel is to assist nursing students to be successful in their fundamentals of nursing exam. The title of my video today is Acid-Base Balance. Today we'll be talking about hypocalcemia. Hypo means low, cal is for calcium, ema means in the blood. Hypocalcemia means low calcium levels in the blood. Normal calcium level is 9 to 10.5. The function of calcium in the blood is to allow us to have strong bones and teeth, muscles to move, and nerves to carry messages between the brain and every part of the body. Hypercalcemia. Hypocalcemia, low calcium in the blood. These are the conditions that causes low calcium in the blood. First, I'll be talking about acute pancreatitis. In acute pancreatitis, calcium shifts into the intracellular spaces from the extracellular spaces. Immobility causes low calcium. Hyperphosphatemia, serum calcitrol is low, resulting in low calcium. Conditions that causes hypocalcemia: alkalosis. When your pH is elevated, your calcium decreases in the blood. Use of calcium binding medications decreases calcium in the blood. Removal of or destruction of parathyroid glands decreases calcium in the blood. Parathyroid glands regulates calcium. Inhibition of calcium absorption from the gastrointestinal tract causes low calcium. Inhibition of oral intake of calcium results in low calcium. Patients with lactulose intolerance have decreased calcium. These patients do lactose-free diet. Malabsorption syndromes such as celiac spur disease decreases calcium. Patients with celiac spur does a gluten-free diet. Gluten is a protein. Example, wheat, barley, rye. Crohn's disease is another malabsorption syndrome in the small intestines. Patients are unable to absorb nutrients well. People who have an inadequate amount of vitamin D, which is used to absorb calcium, decreases calcium. Clients with end-stage renal diseases are unable to regulate their calcium levels in the body. In the polyuric phase, patients with chronic renal failure, there is excessive urine output, risk for hypocalcemia. Diarrhea decreases calcium in the blood. Steatorrhea, fat in stool, also decreases calcium. wound drainage, especially gastrointestinal wounds, result for hypocalcemia. For cardiovascular assessments, we'll notice that patients with hypocalcemia has decreased heart rate, hypotension, decreased peripheral pulses. For respiratory assessments, we'll notice respiratory failure from decreased respiratory movements because of muscle spasms and seizures. In our neuromuscular assessments, we'll notice patients with hypocalcemia has irritable skeletal muscle twitching, cramps, tetany, spasms, seizures. In our neuromuscular assessments, we'll notice painful muscle spasms in the calves, in the foot, during periods of inactivity. We'll notice hypocalcemia. Patients will have paresthesis, numbness in the nose, lips, and ears. In our neuromuscular assessments, Trouser sign is a carpal spasm induced by inflating a blood pressure cuff. Neuromuscular assessment, Chauvet's sign is twitching of the muscles innervated by facial nerve. Hyperactive deep tendon reflexes decreases calcium levels. Anxiety and irritability decreases calcium levels. In our renal assessments, we notice urinary output varies a lot, especially patients with chronic renal diseases. In our gastrointestinal symptoms, we notice increase in gastric motility, hyperactive bowel sounds, cramping, diarrhea. These are all signs of hypocalcemia. In our laboratory findings, we notice serum calcium is less than 9. In our electrocardiographic results, we'll notice prolonged ST intervals, prolonged QT intervals. Intervention, nurses' intervention for patients with hypocalcemia. Nurses will administer calcium supplements orally to patients with low calcium. Calcium also can be administered IV, intravenously. When administering calcium IV, warm injection solution to body temperature before administering calcium IVs. Administer calcium IVs slowly. Monitor your electrocardiogram while you are administering calcium IV. Observe for infiltration and monitor hypercalcemia while you are administering calcium IV. For patients with hypocalcemia, administer medications that increases calcium absorption. We will administer aluminum hydroxide, which reduces phosphorus levels, causing counter effects of increasing calcium levels. When phosphorus goes up, calcium goes down. When we administer phosphorus to our patients, we are causing a counter effect. Administering vitamin D aids in absorption of calcium levels from the intestinal tract. Vitamin D should be administered along with calcium for proper absorption. Interventions for patients with hypocalcemia. We will assess patients for seizures, initiate seizure precautions, safety precautions, pad your side rails, provide a quiet environment. Interventions for patients with hypocalcemia. Move your patients carefully and monitor for signs of pathological fractures. Keep 10% calcium gluconate available for treatment of calcium deficits. Instruct patients to consume foods that are high in calcium while teaching. Patients with calcium imbalance risk for pathological fracture. Move patients slowly and assist with ambulation slowly. Please, YouTube is requesting that we hit the like buttons. Please subscribe if you have not subscribed. Please share my videos. Thanks a lot. Have a blessed day. I wish you all the luck in your exams. Thank you.